Cyanosis. Okay. Opposite of cyanosis, your skin turning red, would be rubor. R-U-B-O-R. Okay. So that was hypovolemic shock or hemorrhagic shock. Hemorrhagic meaning that's dealing with blood, guys. Dealing with if there's severe loss of blood. That's what we're gonna call it, hemorrhagic, also hypovolemic. Okay. So let's talk about cardiogenic shock. Cardiogenic shock is failure of the heart's left ventricle, resulting in the inability of the heart to pump the adequate amount of blood to the organs. Okay, so we see that both hypovolemic and cardiogenic shock has to do with basically like the blood going out of the body, going to the peripheral vascular system. And the last three, which are distributive shocks, neurogenic, anaphylactic, and septic, those are with blood coming back to the heart. Okay, we're clear? Okay. So cardiogenic shock, we don't really see it too often because we're not echocardiographers. It's a major concern when you're doing echoes. Okay, obstructive shock is a category of cardiogenic shock, guys. Obstructive shock is a category of cardiogenic shock that can result from a pulmonary embolus. What's that, guys? Blood clot in the lungs. What is a pulmonary embolus? Okay. Cardiac tamponade, which is the pressure exerted from the fluid being put up. If you have fluid around the heart that's putting pressure on it, that's a cardiac tamponade right there. It's that pressure. Okay. Pulmonary hypertension, which is high pressure in the pulmonary arteries. Okay. Arterial stenosis. Guys, stenosis, that term means narrowing or restricting. Okay. But matter of fact, just narrowing. Okay. So I have a stenosis, meaning that my artery is of a certain size. So this is my artery right here. This is my aorta right there. That's a regular aorta, right? Okay. Here's my second aorta right here. And I have blockage right here. So now I have a narrowing right here, right? I have a narrowing right there. That's a stenosis right there, because that plaque, see my vessel, my blood's going this way, and it was flowing well. It was good, no worries. But then when it gets to this plaque right here, that's stenosis causing this vessel to narrow, because now I only have this much space that I'm working with, okay? So that's a arterial stenosis right there. And then lastly, just to put it all together, what's that right there, Sophie? Aneurysm. Just to put it all together, we have an aneurysm last, which was going to cause it to be bigger than normal. Okay? So, continue on that. Another reason for obstructive or cardiogenic shock would be constrictive pericarditis, inflammation of the pericardium, and tumors within the heart. All of those are contributors for obstructive shock. And when you think about them, they're all obstructive in some kind of way. They're obstructive meaning they're stopping it from functioning at its highest peak, or the best it can. Okay? Because if we have a stenosis, we know that vessel's not performing the best way it should, because something's blocking it from, going through. That's going to increase our pressure distal to that stenosis, right? Because if I close something up, I'm increasing the resistance, right? Okay. Most importantly about these shocks, guys, know what they are. Know the definition of those shocks. Okay. So, remember I said neurogenic. These are the last three: neurogenic, anaphylactic, and septic shocks. They're all type of distributive shocks. Okay. Okay. Neurogenic, often caused by dysfunction of the nervous system, following nervous system trauma, and resulting in the loss of normal functions. Okay, guys. So that's like, it made me think of what happened. Somebody having a like a brain bleed or something like that. It definitely, the bigger the bleed in the brain, the possible larger loss of function you can have too. Right? If you have some kind of hemorrhage in the brain or something like that. Okay. This results in peripheral vasodilation. Guys, peripheral vasodilation meaning That the vasodilation, vaso meaning what, guys? Vessels, right? Vaso means dilation, meaning what?
Dilate.
Getting bigger. Think about when they dilate your eye, they're making their pupil huge. Okay? Same thing. Peripheral vasodilation. So peripheral meaning distal or their extremities. In this case, arms, legs. Like those veins and arteries are dilated. They're bigger. They're gonna be bigger. Okay. Okay. And it's also caused by severe pain or a lack of glucose. Everything I put up here, guys, is exactly what I want you to know about these conditions, all right? These types of shock. All right. So let's talk about septic shock. Septic shock results from the immune system reaction to the invasion of bacteria in the body. So guys, when you hear people say septic shock, they're just gonna say sepsis of the blood or blood poisoning. You know, that's how they describe septic shock. Okay. To fight bacteria, the body releases chemicals that increase capillary permeability and vasodilation. We know what those are, which if not, may lead to shock. Okay. So if you, it made me think of like, I was watching something the other day where they gave somebody the wrong person. Matter of fact, I wasn't thinking that really happened. Somebody got the wrong blood and then that person died. Yeah, I want to say that I'm sure that person went into septic shock from that, you know, from receiving the wrong blood. Okay. Remember, septic shock involves invasion of bacteria to the bodies, more specifically, somebody in sepsis, the blood. A lot of times when people are in sepsis, blood poisoning, they're going to be a contact person. You have to put on your gown to go do that exam. Okay, septic shock right there, guys. All right. Last but not least, anaphylactic shock, guys. That's me having an allergic reaction, guys. What? Anaphylactic shock results from extreme allergic reaction, also known as anaphylaxis.
Can you stand together so I can see the difference?
I'm about to. Yeah. We don't really see anaphylactic shock as far as us concerned because we don't really do contrast-based studies. And studies like CT, where they use contrast, then you're more likely to see adverse reaction to contrast or iodine as far as that goes. I'll stand next to it, do it. So this is me, guys. This wasn't too long ago. This was actually in in August. I mean, this actually happened to me in December. You know, when I went to Atlanta and I ended up eating shrimp. Guys, I know I'm allergic to shellfish. I still eat them.
Well, you can take some medication before you eat those?
You can. I did. Unfortunately, this still happened. Yeah, I took my Benadryl before I went. You know, I'm in Atlanta, you know, balling, eating some hibachi, you know, cooking the meal for us and stuff. Bang! I'm eating my shrimp. Boom, I'm good. I already know this, guy. This is my first allergic reaction. It's probably like this right here is probably my third time. Never this bad. Maybe I had a hive or two. You know, I break out in a couple of hives. I remember one time, the first time it happened to me, I was in Dallas. I thought I had bed bugs. Well, I was down there talking bad to the maintenance person because I was itching like crazy after leaving Red Lobster. I was like, man, what's going on? You know, and I thought it was bed bugs. I said, man, if you don't give me another room, man, we're gonna have problems. Bang, I got another room, still itching. Man, I had to go get some Benadryl. That's when I was like, man, something about that shrimp scampi and Red Lobster got me. Okay. The second time, how I knew it was Red Lobster because I had Red Lobster here. I was like, man, something not right. And then when I went to Atlanta, I already know I still eat shrimp regardless, guys. I still eat shrimp. But maybe because it was that Atlantic shrimp and not that Gulf shrimp, you know, that's what I'm blaming it on because I never had an adverse reaction. God, it was so bad. This right here is about 20 minutes after I ate it. This isn't even the worst. I don't even want to show y'all the worst. When I tell you I look like Hitch, when he took her to the Statue of Liberty, wherever he took her to, I look just like that. I look really, really bad. This is the only one I had the courage to show you guys. And you can see, look at my face. It looks horrible. But this was, imagine my whole body looking like that. That's how it was. You know, so if I would have had anything like, you know, allergic reaction get worse and worse every time. So the next time I showed this picture for relevance because I may go on a shock the next time it happens to me because everything happened to me except my throat, kind of swelling up on me, So I was good, but at the same time I had to fly this day and I was ugly. I was vain, you know what I mean? I wasn't itching anymore because I stood in the shower for like an hour and a half, just letting the water hit me. I hate I was to do that to my boy water bill, but I needed it. So guys, anaphylactic shock or anaphylaxis, extreme allergic reaction. Okay, that usually happens in a MRI, CT, somewhere where they're given or nuclear medicine, somewhere where they're given contrast or some kind of contrast agent. Okay, such as what's the name of our contrast agent?
Antihistamine.
Isoview and what?
Antihistamine.
Antihistamine. That definitely can cause. That's the pump, right?
No, you have tablet, you have injection.
Okay. Yeah, anything like that. So those are types of shock right there, guys. Any questions on our 5 types of shock, right? Hypovolemic or hemorrhagic. The next one, guys, cardiogenic, neurogenic, septic, anaphylaxis.
I call it JT shock.
JT shot. Looking real bad. Okay. So there have been some reported adverse reactions, including anaphylactic reactions to contrast agents. Sonographer must closely monitor patients, and there must be procedures for quick response to emergency situations. Be aware of the possible side effects. Your response to any form of shock should be immediately call your emergency response team. Right? That's the first thing we do. Call for the emergency response team, or if you're not at the hospital, call 911. Okay. Do not leave the patient. Place the patient in a position that best facilitates breathing. Guys, if they're not, I would, first you have to check for breathing. Probably lifting them, putting them in the semi-Fowler's position probably be the best one. Okay, unless they're having a seizure. Okay, place that patient, monitor patient's vital signs, and be prepared to assist the emergency team. Again, like I said, don't just leave. Make note of the time and assistance provided because they're going to ask you questions. Okay. Let's talk about syncope, guys. Syncope simply is just fainting. An example we would do, say for instance somebody was struggling with syncope or fainting. An example we would do would be carotid arteries, okay? Because if they have a loss of blood going to the brain, that can cause you to faint because you are going to have a temporary loss of consciousness. That's what syncope is. Syncope is fainting, which is a temporary loss of consciousness. So, I don't know, you see it on TV all the time. Have you ladies ever experienced that? You see him, and a high guy, and he's so high, you just, you see it on TV all the time, right? Nobody experienced that when y'all seen me? Y'all out of line. It typically results from deficient blood supply to the brain, which is why we would do a carotid artery, because those are the vessels that take blood to the brain. Okay? So if there's a blockage or a stenosis like this, that's restricting blood from getting up to the brain. Okay? Which can cause, or if you just have a blockage in the circle of Willis. Circle of Willis meaning the arteries that provide blood to the brain, different parts of the brain. If you have a blockage, luckily, the brain is so amazing, those arteries so amazing that, if one gets blocked, blood can travel another way and get to the same area. But if it's too bad, then you may lose consciousness, okay? It can also be caused by heart disease, hunger, poor ventilation, extreme fatigue, emotional distress, or trauma, okay? Clinical manifestation includes pallor or skin paleness, dizziness, nausea, hyperpnea, which is, increased depth of breathing. So, that may be like that. That would be hyperpnea. Okay? Taking those really, really deep breaths in, tachycardia, okay? And cold and clammy skin. Several patient populations are more prone to syncope. Those patients include older patients. Again, those older patients, they're most likely to suffer from orthostatic hypotension, right? Orthostatic hypotension. So they may, from them going from supine and sitting up, that can cause them to faint. I've seen it happen before. I've seen it happen right on the bed more than one time. Okay? So that's why I have my patients have a seat, just hang out for a second. Patients taking certain medicines, obstetric patients, those patients deal with syncope. They also deal with a condition known as supine hypotensive syndrome, and that's when maybe late in gestation, when the fetus is so huge, you know, the uterus can push on the IVC, causing the blood not to get back at the rate it should. Okay? Remember I said also the fetus can get so big, it can push on the renal vessels, and it can push on the ureters, causing you to have fluid in the kidneys, and causing your kidneys not to proper work to function properly, you know, depending on that fetus. But if supine hypotensive syndrome, you know, that's something that can happen to obstetric patients, okay? That's a term in your book, guys. Term in your book, okay? If a patient faints, call for assistance, place the patient in the supine position, and elevate the patient's legs. Take care to prevent injuries without injuring yourself, guys. If the patient faint on you, I know the book says get behind them and like hit their knee and let them fall down. If somebody's that much bigger than you, you're probably not gonna be able to do that. You know what I mean? So help that patient down if you can. You know, don't just let the patient just blam, just hit everything. But you know, if you can lift the patient up, you know, don't hurt yourself and the patient. You know what I mean? So just take care, be conscious or be cognizant when you're making those moves. Because if you've never done that, when you get behind somebody and you hit their knee and you help them down, your first time doing that, you know, you might have a patient that's 6'3", 250 pounds. I can't do that, you know, with ease. So just be careful right there.